Hello, I'm Chuck Salters. I'm a cardiologist associated with the University of Kentucky Gil Heart Institute that is stationed here at the Clark Regional Medical Center. I chose cardiology as a career. Basically, when I was a child, my mom worked for a group of cardiologists, and I would go in and I would see the pictures of the heart on the wall. And one day I interviewed a cardiologist for a career day, and he showed me around to the cardiac catheterization lab, and I could see where they were saving people's lives, and became really fascinated with how the heart worked and how it developed. I actually was a paramedic for about 7 years before I went to medical school. I went through medical school at the University of South Alabama. Then I did my residency in internal medicine at the University of Kentucky, and I was fortunate enough to be able to stay there at the University of Kentucky for my cardiology fellowship. On my free time, I enjoy time with my family. I have a beautiful wife and 3 lovely daughters who are growing up fast, and we have a small farm in Lexington, and we have some alpacas and horses and dogs and cats, and fortunately now we have a few that are males, and not every animal that we have, along with my daughters and wife, are females, so there's a little more testosterone around my place these days. The most challenging thing I think for patients is to just make the lifestyle changes that are necessary, getting the weight off, trying to stick to a heart-healthy diet. Smoking cessation is always a very difficult thing for everyone. Actually, if I could get patients to realize that making lifestyle modifications and changing the way they're living their lives can make a bigger difference than any of the medicines that I can provide them, that's a battle that's fantastic when it's won. Management of heart failure in the last decade has really improved. We're seeing what used to be a death sentence when you were diagnosed with heart failure. Now people are doing much better. The medications that we're using are making huge differences in people's lives. They're living longer. They're living happier, healthier lives. The best part of any day is when you save someone's life, when you know that you've made a difference, you've sent them to the cardiac catheterization lab and opened up a blockage to allow them to get back to living the life that they want to enjoy.